Hello, am I audible to everyone? Hello, I'm Dr. Sumbal Ijaz, your MRCOG-1 mentor here with Instutors. Our goal is to facilitate and guide you throughout your MRCOG-1 journey. So welcome to the Instutors. Okay, so today's session is all about an introduction to MRCOG. We will discuss the benefits, how to book the exam, the necessary study material you need to pass the exam, and what is included in your MRCOG-1 curriculum, which is provided by the RCOG. We will also look into the exam format and how you can solve the SPAs. Additionally, we will study the femoral triangle and practice a bit SPAs from that topic. So let's start. Why MRCOG? This is one of the frequently asked questions. Many candidates, they ask us like why we are going to book the MRCOG exam. What is the benefit of passing this exam? So here's a list. Yes, since it's a highly recognized exam, it is a membership exam of Royal College of Obs and Gynae London. If you pass that exam, if you had that membership, then you can practice in the UK. After passing your MRCOG 1, 2, and 3, you will able to get GMC registration from the UK, and then definitely you can apply for the jobs. You can also earn high credibility in most of the countries as well as in your home country. Because since it's an exceptional exam, and when you pass your MRCOG exams and have your membership, that is something exceptional achievement. And once you have that exceptional achievement with you, definitely your credibility in your home country as well as you would be globally recognized by this. You can also can work at senior level in all countries. So this is a list of benefits if you have your MRCOG, your membership of Royal College of Obs and Gynae. Then what should I know about MRCOG? So everything you should understand about MRCOG Part 1 exam is that you should have a good understanding of exam structure, like what sort of question come in the exam, what is the basic format, are they single best answer question or are they true or false statement question, what is the exam structure and the format. Then you should need to know about the exam calendar. For now, the exam calendar for year 2025 is not yet uploaded on the website. Once the RCOG upload the exam calendar and the fee structure, we will let you know. So don't worry about that. Same goes with the exam fees. So this is another frequently asked question. I understand everyone is working day and night. We are saving money and we are putting a lot of amount of money on this exam. So you should have a clear understanding what is the exam fee and how you can find out according to your band. So here's the thing, on the RCOG website, they have divided globally all the countries into 3 bands, which is band A, B, C. So you have all you have to do is to look into that list, find out your country and look for the fee. For example, for the countries who fall in the band B, especially the countries India, Pakistan, and Bangladesh, they fall in the band B, and the fees for year 2024 was £555. However, they haven't uploaded the exam and fee structure for year 2025. And once that is available on the website, we will update you. So the next thing is the eligibility. So what is that eligibility? Anyone have any idea? Please do let me know. Yes, Sarah, you are right. So what is your eligibility to book MRCOG Part 1 exam? What type of documents or degree you need to book this exam? So the answer is yes. The primary qualification, that is your MBBS degree, is more than sufficient to book the exam. Yes, Sarah, you're right. Then the next step is booking process, how you can book the exam. So in a nutshell, there are 3 steps when you want to book your MRCOG-1 exam. The first step is your eligibility. For that, there is a form which is available on the RCOG website, and we also have that form. All you need to do is to fill that form, attach your medical degree or your medical practice license along with your ID card or your passport, and mail them to the RCOG. And this process might take 3 to 4 weeks. So that's why we always encourage our candidates to go for this step as soon as possible, because sometimes that might take some longer time than usual. So what is your next step in regard to your booking process? Once you're done with eligibility, you have to go on the website and submit the expression of interest. And after that, once you submit your expression of interest, on the day of booking opening, you have to buy your slot and pay the fee. So that would be your last step. For now, just focus on the eligibility criteria because for now, the portal is not yet open. So there's no point to go in detail of those steps. So I will guide you further how you can fill your eligibility form and email them to the RCOG. So now we are done with the booking process. If anyone have any question or if you have any confusion regarding how you can book the exam and what is your eligibility, please you can ask me anytime. Okay, so for instance, now you are done with your booking process. Now you have understanding regarding your eligibility, and now you have an idea about your exam and fee structure. Then the next most important question is that what kind of study material I need to pass this exam, and how I can study for the exam, and how much time I need to pass this exam. So these are very genuine questions which comes from the candidates. So let me address your queries one by one. So again, in MRCOG, it has 3 parts. The part 1, which is theory-based exam. Then MRCOG part 2, it is also theory-based exam. And then you have your last step, which is your OSCE exam. Dr. Mashkura, I just have told you they haven't uploaded the exam structure and the exam calendar for January 2025. It might take another 1 month, but as soon as they upload that exam calendar, we will let you know. Okay, what is the exam structure for MRCOG Part 1 exam, which is your theory-based exam? So it is a computer-based exam that includes single best answer questions. The exam comprises of 2 papers. One is your paper 1 and other is paper 2. And each paper has 100 essays. Exam duration for paper 1 is 150 minutes. That means 2 hours and 30 minutes. And same goes with the paper. Then you will get 1 hour lunch break. And then you have another paper, which is your paper B, for the same period of time. And in order to pass the exam, you have to clear both paper 1 and paper 2. And yes, eligibility for part 1, only primary medical qualification is required, and this would be your MBBS degree. And either you may go with your medical license, and another thing which is important is your ID card photocopy or your passport photocopy. So these things are needed along with the eligibility form. You have to fill the form, do these attachments, and mail them to the RCOG. The next step is what subjects I need to cover for the MRCOG-1 exam. So this exam is all about your basic knowledge, your understanding of your basic subjects, like how much do you know about anatomy, biochemistry, physiology, endocrinology, pharmacology, pathology, genetics, embryology, clinical management, data interpretation, and statistics. So these are the subjects you need to cover. What are the recommended books? So mainly the books for the theory, which are recommended by RCOG, are Oxford Revision Notes, Essential Revision Guide. So these two books are your basic theory books. For SPA practice, we recommend Endosizer 550 SPAs by Catherine. There are other two books, which is SPAs by Ankush Roth, Get Through SPA. So these are some renowned books for SPA practice as well as for the theory. And it's all up to you which books you want to follow, which books format suits you the most. So it's up to the candidate's choice what type of material they want to follow. So from our experience, we mostly recommend our students to go and study Oxford Revision Notes or Essential Revision Guide for their theory. Either they can go with the Oxford or Essential Revision Guide. And for SBS, there is a book which is 550 SBS by Catherine. This book have two types of format question. One which is true false question, which mainly has to comprehensively tackle a topic of theory. Then they also have some SBS at the end. So this is also a good book for the practice. Then yes, exam type questions you need to revise more, at least thrice before the exam. And the last is your past MRCOG. So again, these books we recommend from our experience to our students. So again, this is how you can book your exam. First thing first, you need to go on the RCOG website and make your account. Then yes, submit your eligibility form, which I have already told you what type of attachments you need and from where you can get this eligibility form and how you can email that. Then the next step would be expression of interest. The portal is not yet open, so you can wait for this step. But make sure you have to submit this expression of interest before the deadline, and same goes with the eligibility form. Then you have to book into a country location, use your booking token for an available space. This step comes when they announce the seats. And then book into a Pearson center, schedule your exam in your chosen country location. So this is your last step for the exam booking process. The main thing, the main worrisome query for the students, like how we will start preparation. So any idea, any suggestion from any listener at the moment, how we can start the exam preparation? Anyone who has already started the exam preparation for January exam? Okay, so let me tell you, whenever you are going to start your exam preparation, so for now you have an idea what type of subjects you need to cover, what type of exam format you have in your exam, and how many questions you are going to have in your exam. Now, how to tackle the theory and how to solve the SPAs, this is your major task. So when it comes to theory, try to focus on high yield topics from all the subjects. Why? Because one thing I always advise my students that believe in, this is something which I personally believe in, that you read something which is maybe less in quantity but good in quality. So this thing I implement here. Try to focus on the high yield topics and have a strong grip on that topics, have a good understanding of those topics, revise them most frequently because many questions comes from the important topics, because that's not possible for us to cover all the topics, all the anatomy, all the physiology, or all the pathology in a very short period of time. So this is something you can do. This would help to save your time. It would build your confidence because when you are solving SBAs, and many SBAs come from the important topics, and when you are easily solving those topics, it would help to boost your confidence. Then follow the daily mini schedule of the study group. We provide our students with a mini schedule to help them to motivate and keep them on the track. For instance, for anatomy, we have a list of high yield topics and we have divided them in a number of days. And if you follow that schedule, that mini schedule, then definitely you will ace the exam in one go. Then you can join the live sessions with me to clarify your concepts or for each subject. Another, the most important thing, practice daily SPAs. If you are studying just theory, that's I'm so sorry to tell you, then that's not enough to pass the exam. If you have only studied very thoroughly all the Oxford Revision Note or Essential Revision Guide or any other book, and you are not practicing SPS daily, then that's not possible for you to pass the exam easily. So for that, I would advise you to practice SBS on everyday basis. And to encourage this thing, we have this activity on our Telegram study group where mentors are available and you may have a live session with them and you can practice daily SBS with the Telegram group and with your colleagues on that group. Then practice subject-specific exam like questions on the website. We have that tool. For instance, if you are studying anatomy, you have studied a topic in the live session or on the from the Oxford Revision Notes, and then you practice those questions on the Telegram group. Then the next thing you can do is to solve the exam like questions, the subject-wise question on our website. And once you are done with all of these steps, the final step would be your subject-wise mock, which is also uploaded on our website. And what are the benefits of solving subject-wise mock is to that you can identify your weak areas, you will know your assessment, you have your performance in your hand, and there you can assess that which topics I need to study more and what type of mistakes I'm making while I solve the SPAs. So mocks are very important for your self-assessment. Am I making sense so far? I always encourage my students to ask me questions. You can stop me anytime. You can open up your mic and ask me anything. Okay, thank you so much. So let's continue. Okay, so once you have your mock result in your hand and now you know your weak areas, you can anytime share with us. You can ask any help for if you find yourself confused in any SPA. You can anytime text us. You can drop a text in the Telegram group. You can either drop your text on the WhatsApp group. We will answer your queries. Get evaluated by the mentor for each subject to build a strong foundation from the beginning. So this is how we take our student together and we will support and assist them for their thorough exam preparation. Okay, what should I have as a premium student? So if you are in the premium student course, then what benefits you will have? You will have a course material in terms of mini schedules. You will get the website access. You will have the WhatsApp study group, Telegram study group, course schedule, and the mini schedules. And again, all of these steps I have already explained you. This is a quick recap. how we can pursue our course, and how we are following the structured approach for the MRCG-1 exam preparation. So again, we have main schedule, then we have mini schedules for everyday basis, in which we assign the tasks on the daily basis. Then the live sessions on the Zoom link, live session recordings, you will have the recordings of those sessions. So for instance, if you miss the session, because we understand we doctors have a very busy schedule, we have to do day and night duties. So don't worry about that. If you miss the live session, then the session would be uploaded on our website. You can anytime watch the session. Then all the study material books in the PDF form, they are already uploaded on the website. Subject-wise mocks, subject-wise recalls, PDFs. These PDFs are the live sessions presentation. You will have a mini booklet. It would save a lot of your time. For instance, if you don't have enough time to go through from the Oxford revision note or essential revision guide, you can simply see and look at these PDFs and clear your concepts. Then at the end, we will arrange big mock exams for you. Again, this is again the website access. What will you're gonna have? Again, the live session recordings, year-wise exam type questions, subject-wise mock PDF of all subjects, revision flashcards, and the big mocks. Okay, let's talk about some serious things. Again, if you have any question up till now regarding what is MRCOG-1, how we can book the exam, what is eligibility, exam structure, please, you can ask me. Okay, so let's start our MRCOG-1 curriculum, which is provided by the RCOG. So what does that mean? What is your curriculum? Basically, it's your exam syllabus. The RCOG has provided the knowledge areas, like what type of information, what type of knowledge they are expecting from you at the MRCOG-1 level. And it helps to solve many questions, because many students, for instance, if they have started studying anatomy, they just got panicked that they have to study head and neck, thorax, abdomen, upper limb, lower limb, pelvis, and perineum. So the good news here is that for MRCOG-1 exam, in terms of anatomy, you have to focus on the anatomy of abdomen, pelvis, and perineum. So isn't it great? There is no need to study deeply about upper limb, lower limb, or the thorax, or the head and neck. So let's have a deep dive into the knowledge areas which are provided by the RCOG. So basically, they have divided in total knowledge areas 15. Here you can see we have total knowledge areas 15, and I have highlighted only the topics which are relevant for the anatomy. So let me give you a brief. The knowledge area 1 is the clinical skills. Then you have a knowledge about teaching and research, core surgical skills, post-op care, antenatal care, maternal medicine, management of labor, management of delivery, postpartum problems, gynecological problems, subfertility, and this subfertility mainly covers your endocrinology, sexual and reproductive health, early pregnancy care, gynecological oncology, and then urogyne and pelvic floor problems. So these are the knowledge areas and under which your different basic subjects fall. Let's have a look on the anatomy. So in post-op care, they have this knowledge area in which they have mentioned about the histopathology of pelvic organs, breast, endocrine organs, including the pituitary and the hypothalamus. Then in the antenatal care, you should be able to know about maternal, anatomical, endocrine, and physiological adaptations occurring in pregnancy. So this is an extension of endocrinology and physiology, focus on maternal anatomy. Then you have an idea a bit about fetal anatomy as well. Then under the knowledge area of management of delivery, they are expecting that you should be knowing about female perineum and principles underlying the management of perineal repair. And this covers your anatomy of perineum. Under the knowledge area of gynecological problems, you should be knowing the anatomy of female reproductive tract, including an understanding of changes at puberty and at menopause. Again, the puberty and menopause, this is something extension of your physiology topic. However, again, focus on the anatomy of the female reproductive tract, and it mainly covers the anatomy of pelvis and perineum. Then in the knowledge area subfertility, they're expecting anatomy, development, function, cell biology of organs of male and female reproductive tracts in context of their relevance in fertility and its disorders. So again and again, they are asking for the anatomy of female reproductive tract, and here they have mentioned about males as well. So again, in terms of anatomy, I'm claiming this point, you have to cover anatomy of abdomen, anatomy of pelvis, both male and female, and anatomy of perineum, both male and female, and a bit about fetal skull. So this is all about your anatomy. Am I clear? Then in the knowledge area 14, which is your gynecological oncology, they're expecting surgical anatomy of the abdomen and pelvis. So here they have mentioned you should be knowing about anatomy of abdomen. And when we will start our anatomy of abdomen, we will share what kind of SPS you're going to have, what kind of surgical correlation you will get from the anatomy of abdomen. And this is something from your neuroanatomy, pain pathway, transmission of pain, pathology of pain in gynecological malignancy. So this is an extension of pathology as well. The purpose why I have highlighted, in terms of neuroanatomy, we mainly cover the lumbar plexus and the sacral plexus, because that is something relevant to the obs and gynae. And yes, some of the peripheral nerves. Then knowledge area 15, which is your urogynae and pelvic floor problems, structure of bladder and pelvic floor and their innervation. This is very, very high yield. They have frequently asked the question about the blood supply and the nerve innervation of the perineum. So this is important. This is your some sort of a mixed topic which covers your anatomy and your physiology as well. Mechanism of continence and micturition and principles of pelvic floor support. So again and again, let me show you, and this is the whole your MRCOG-1 curriculum. They have in no knowledge area, they have mentioned about the anatomy of upper limb or the lower limb or the thorax or the head and neck. So again and again, they are asking about the structures and the organs of the female genital tract or the bladder, perineum, and abdomen. Am I clear about this?
Yes, ma'am.
Okay, that's perfect. So let's start, have a glance at anatomy before the life. So the purpose why I have added this demo topic, that you have an idea how you are going to study anatomy, how you're going to extract the high yield information from any theory topic, either you are studying from the Essential Revision Guide or from the Oxford or from any other source. So let's start. What is femoral triangle? So basically, it's a triangular depression on the front of the upper 1/3 of the thigh, immediately below the inguinal ligament. Here you can see here, it is a wedge-shaped area formed by a depression between the muscles of the thigh. Again, here you can see the anatomical location of the femoral triangle. It is located on the medial aspect of the proximal thigh It is the region of the passage of main blood vessels between the pelvis and the lower limb, as well as a large nerve supplying the thigh. So this is a basic introduction. What is femoral triangle? Again, you can see here, it is a wedge-shaped depression which is located on the medial aspect of the proximal thigh. So when you are studying femoral triangle, what objectives you need to cover in terms of this topic? You should have an idea about the boundaries of femoral triangle, its contents, what is femoral sheath, and what is femoral canal. So these are the 4 objectives, and from this knowledge area, you will get the SPS. Either in the exam, you will get a question on the boundary of femoral triangle, either about the contents of femoral triangle. They may ask you about the contents of femoral sheath, or they may ask you a question on femoral canal. So these are the 4 objectives you need to keep in your mind when you're studying femoral triangle. So let's study one by one. What are the boundaries of femoral triangle? So we can easily remember by using the word sail, in which S stands for sartorius muscle, which is the lateral border of the femoral triangle. Then the medial border of the femoral triangle is formed by the adductor longus muscle. Then it has a base or spear border, which is made by inguinal ligament. The floor has 4 muscles that can easily remember by the mnemonic APPI, which is adductor longus, pectineus, psoas major, and iliacus muscle. The roof is formed by the facial lata, superficial fascia, and the skin. And the apex of the triangle is pointed towards the adductor canal. So don't worry, I will show you a diagram and this will make more sense to you. So this is your femoral triangle. And now let's look at the boundaries. The lateral boundary, this is your lateral side. It is made by sartorius. The medial boundary, it is made by adductor longus muscle. And you can see here, it is bounded squarely with the inguinal ligament. So these 3 points are important to remember. Then the next step, the next objective is the contents of femoral triangle. So the mainly you need to remember the femoral triangle have femoral nerve. And meanwhile, I will encourage you to remember the root values because they are really volatile. And from the day one, if you made your reflex to whenever you are studying any, if you see the name of any nerve, go and look the root value. Either they are asking or not, just make this your habit that you, because at the end, you will sure about the root values. Because in the exam, there are many questions in which sometimes they directly ask you about the root value or indirect way. So the root value for the femoral nerve is L2, L3, and then L4. Then the next content is femoral artery, which is a branch or the continuation of the external iliac artery. Then femoral vein, which is the proximal continuation of popliteal vein. The word navel is used as a mnemonic to orientate the contents of the femoral triangle from the lateral to the medial as follows. So now here is another tip. In the exam, either they will ask you the relation or the contents of the femoral triangle, either from lateral to medial or the medial to lateral. So these are the little mistakes you made during the exam. So always read the statement carefully. If they are asking the relations of the contents of the femoral triangle from lateral to medial, follow this mnemonic navel. The first, the most laterally is the femoral nerve, then artery, vein, femoral canal, and the lymphatics. And if in the question they ask you the relation from medial to lateral, then you have to reverse the order. In that case, the mnemonic would be VAN, femoral vein, artery, and nerve. Am I clear?
Yes, ma'am.
Okay. So again, here you can see it is a comprehensive diagram of the femoral triangle, which is showing the boundaries and the contents. So again, let me recap about the boundaries. the more we will revise. This is the best way to memorize anatomy. For anatomy, I will encourage you to go and look at the diagrams again and again, because anatomy is all about visual study. Okay, so again, this is your lateral side of the femoral triangle, and on lateral side, we can see that there is sartorius muscle. On the medial side, we have adductor longus muscle. Another important point is here is that sometimes they ask you, sorry, what muscular border made these boundaries. So medial border of adductor longus, and also either the sartorius, yes, we know that sartorius makes a lateral boundary, but the medial border of the sartorius muscle forms the lateral boundary of the femoral triangle. So please note the difference here. Don't confuse yourself by thinking that, yes, sartorius is making the lateral boundary, but the border of the sartorius muscle, which is involving the making the boundary of femoral triangle, is the medial border, not the lateral one. So in simple way, the lateral boundary of the femoral triangle is made by the medial border of the sartorius muscle. Am I clear? These are the little points. These are the mistakes you made during the exam. Okay, now let's look at the contents. Okay, on the lateral side, now we are moving from lateral side to the medial side. And please tell me in the chat box what mnemonic I have just told you if we are moving from lateral to the medial side. Please type in the chat box, or you can open up the mic and tell me the mnemonic. Or tell me what is the lateral most content of the femoral triangle. Yes. So what is this structure? Yes, it is femoral nerve. And then the next we have femoral artery, which is a continuation of external iliac artery. Then we have femoral vein, which is a continuation of popliteal vein. And now here is the introduction of femoral sheath. Now you can see that this is the green color, which is covering the femoral vessels. This is your femoral sheath. It mainly covers, it encloses the upper 3 to 4 centimeter of the femoral vessels. Here you can see that. Now let's have a look what is femoral sheath and femoral ring. So let me brief here. The opening or the upper border of the femoral sheath is known as femoral ring. So this is how you can simply remember what is femoral sheath and what is femoral ring. So in the femoral triangle, the contents excluding the femoral nerve, are enclosed in a wrapping of fascia called the femoral sheath. This is a funnel-shaped sheath, best described as a sleeve of fascia extend towards the apex of femoral triangle, where it is fused with adventitia of vessels. It continues spirally with the transversalis fascia and iliac fascia of the abdomen. Okay, now the good news here is that you don't need to remember each and every line of the theory. Even I don't recommend you to memorize all of these points, because that is totally irrelevant. The main point, the thing which is important, that you have a good understanding, you have a good concept about particular topic, and in terms of memorizing stuff, you need to memorize the high yield points. So this is how you can tackle theory. For instance, you can imagine this is a page of your Oxford revision note. So that's truth. You cannot memorize each and every line of Oxford revision note. So how you can tackle, how you can extract the high yield information? Okay, if I look into this slide, the high yield point I might be thinking is this point, which is excluding the femoral nerve. Why this point is important? So this is important if in the exam they ask me about the contents of femoral sheath. Now I have idea, if I look into this picture, the femoral sheath is not covering the femoral nerve. Is everyone clear? Are you able to see the difference? How
Yes,
the
ma'am.
Okay, that's good. Again, femoral sheath, which covers the upper 3 to 4 centimeter of the femoral vessels, it do not include the femoral nerve. So if someone asks you which of the following content is not the part of femoral sheath, the answer would be femoral nerve. So this is how you will get the SPA. Okay, each of the structure located in the femoral sheath is individually enclosed into its own compartment. The most medial compartment is the femoral canal, which contains the lymphatic vessels. The proximal opening of the femoral canal is the femoral ring. So here comes your femoral ring, which is the proximal opening of your femoral canal. And what is your femoral canal? It is the most medial compartment of your femoral sheath. So let's clear our concepts here. This is a very nice diagram. Here you can see again your femoral sheath. I will revise again and again so that you can memorize here with me. For now, we know about the femoral triangle. We know about the contents of femoral triangle. Our next extension, our next objective in this topic is the femoral sheath. And for now, we know that the femoral nerve is not the part of femoral sheath. So what is the contents of femoral sheath then? We have femoral artery, femoral vein, and yes, we have lymph nodes. And the most medial compartment of the femoral canal is, it contains the lymph nodes, which is also known as lymph nodes of Cloquet or Rosenmuller lymph nodes. And one important thing, the compartment, it is a lateral compartment of femoral sheath. It contains femoral artery, along with it contains the femoral branch of genitofemoral nerve. Yes, we know that femoral nerve is not the part of femoral sheath, but yes, femoral branch of genitofemoral nerve is present within the femoral sheath in the lateral compartment. Then we have intermediate compartment, and then we have the medial compartment. And this is your femoral canal containing lymph nodes of Cloquet or Rosenmuller, and the superior boundary of this femoral canal is known as your femoral ring. So again, femoral ring is closed by connective tissue layer in the femoral septum, which is pierced by the lymphatic vessels exiting the canal. Cloquet node is a lymph node situated in the femoral canal. So this is all about femoral ring and femoral canal. Again, this is a recap. You can see here the inguinal ligament. The extension of inguinal ligament is from the interior superior iliac spine up to the pubic tubercle. And below that, here we can see the femoral triangle and its content. This is a better picture. Here we can see femoral nerve, which is not the part of femoral sheath. And in femoral sheath, here you can see the medial compartment have artery, then vein, and here is our femoral canal, and the opening of the femoral canal is our femoral ring. So this is all you need to know about this topic. Okay, if anyone have any question from femoral triangle, you can ask me. Otherwise, I will give you the demo question. Should I move on? Okay, so you have 45 seconds to answer this question. Okay, so your question is, the femoral triangle is bounded medially by which of the following structure? Option A, inguinal ligament, B, inguinal canal, C, adductor longus, D, adductor brevis, and E, sartorius. Write your answer in the chat box. Okay, that's perfect. C is the right answer. Please tell me which border of the adductor longus muscle made the medial border. I just want to make sure you have good understanding. That's brilliant. Yes, and please tell me what is the lateral boundary of the femoral triangle? Yes, excellent. That means all of you were listening to me. That's great. Okay, here are some tips and tricks to solve SPAs. Always, 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 especially when you're practicing your SPAs, make these things into your habit that whenever you find any SPA, try to understand that question, like what the examiner wants to expect from you. And always do emphasize on the last line of the question, which is very important, because sometimes when we will study more about different topics and when we will practice more and more SPAs, I will show you the demo. Sometimes in the question, they will give you a distractor. They will give you a patient scenario, which is totally irrelevant from the question. And in the last line, they ask you something different. Maybe they will give you a clinical scenario and then ask you about the physiology, and maybe they will give you a clinical scenario and ask you about the pathology or anatomy. So that's why always the last line of the question is very important. And sometimes many students confuse the answers. They know the knowledge, they know the answer, but still they mark the wrong choice. Why? Because sometimes some options might suggest that pick the odd option, and you go and choose the right option. But in that particular question, they were expecting that all the answers are correct, but you have to pick the wrong answer. So these are the little mistakes you have to work on. Then elimination. This is a good strategy. I mostly follow this strategy. This is something called excluding method, in which, yes, you read the question carefully, you read the last option carefully, last line of your question statement carefully. And when you look at the options, for instance, you have no clue about the answer. This is your saving strategy. Use your basic knowledge, use your common sense, and try to exclude the totally irrelevant options. And at the end, you might have two options left, and you can easily pick. And now you have to choose between two options rather than five options. So this would save your time, and also it would give you an idea what answer could be correct. Then don't rush. You have 1.8 minutes for each question. And during practice, I will suggest you set your timer at 45 seconds so that your reflexes will be built. Then use your clinical reasoning. Think about clinical implications of each option. Then practice. This is the ultimate key to pass the exam. The more you practice, the more you would become polished, the more you would become confident on your knowledge. And also, if you practice more, you will save a lot of your time. So build your reflexes and practice more and more. And I would recommend my students always try to revise all your curriculum at least thrice before the exam. Okay, let's go back to the question slide. Dr. Seva, are you asking about this question? Okay, you're asking about the exam. Yes, definitely, you can go back. Okay, in the exam, you will have your portal, you have to log in, and then you will have your paper one, which have 100 questions. And there is an option of red flag. For example, if you find yourself confused and you cannot answer your question, you're not sure about the answer, and you need to spend some time to think about that SPA, you can simply red flag that question. And yes, you can, at the end of when you solve all of your SPAs, you will get a page in which they have mentioned a list of those questions you didn't mark. Then you get a question list which you red flagged. And then there is a third category in which they have listed the question you have already marked. So now this is your choice. You can easily go back to your question and you can change your answer, or you can solve the SPA at that time. Am I clear? Okay, good. Okay, for technical support, For the links of the session, for session recording, for the website assistance, you can contact our helpline number. You can either contact us on the Facebook page, or you may simply email us on this email address. And for now, we have this offer. Our course fee would be $250 till 1st of July. So don't miss out on this opportunity. So if anyone have any questions so far, you can ask me. Thank you, Dr. Mashkura. Okay, Dr. Seva, that's a very good and very valid question. So the question of Dr. Seva is that for clinical part, which book do you recommend? So the answer is the clinical management as well as your data interpretation. It does not follow any particular subject or any particular module. Basically, if you have a good understanding of all the modules like anatomy, pathology, if you have studied thoroughly about the clinical correlation, it would cover a lot of your portion of clinical management as well as your data interpretation. And it is mostly related to your clinical practice, what you have done every day in your ops and gynae department. The important thing where we confuse our answer is that your guidelines. The main problem I have witnessed so far, many of the students, they confuse their hometown practice with their guidelines. Because in many countries, they don't strictly follow the guidelines, which are recommended by NICE or RCOG or the BASH guidelines. So for that, you have a bit understanding of the guidelines. But again, the guidelines are way more important for your MRCG Part 2 exam. For Part 1 exam, you have to study in a very focused and in smart way, because this exam is all about your basic management. For instance, if I have taken the topic of heavy menstrual bleeding, so the questions in the clinical management would come on the day one. If the patient comes with heavy menstrual bleeding, what would be your first step in terms of management? Then they may give you a scenario in which the patient have already done with the first step. Now, what would be your second step? So this is how we will study the guidelines, not in detail, just the information we need to follow, we need for this exam. So again, this is a very precise exam. I again don't encourage everyone to go in a very detail of theory or the guidelines. Be smart and study smartly for this exam. Welcome, Dr. Hussain. And trust me, when we were taking our last course and when we come over on the last module, everyone clear about the basic things because the questions and the concepts are repeating everywhere. So if you have a good understanding of pathology, some of your portion of your clinical management will already covered. So there is nothing to worry about much. Okay, Dr. Zahra, that's a valid question. Okay, in terms for the booking of MRCOG-3 exam, they have two routes. There's route A and route B. The route A is requires a 2-year clinical experience, which is your specialty training experience. And for route B candidates, they ask for 4-year training experience in ops and gynae. So first thing first, you need to see that in which route do you fall, either on the route A or B. So route A mainly, the route A is followed by the doctors which are working in Canada, in Singapore, or Canada or Australia, or in the simple words, who are working in the first world countries. And route B mainly follows by the Indian doctors, Pakistani doctors, Bengalis, Nepal, I mean, basically from the Asian doctors. So they follow the route B. Training experience would be more appropriate. Either it is FCPS or MS. Yes, Dr. Ayush. Uh, our course is simply a one-stop platform. We have gathered all the information in one place because this is something what we noticed, and we discourage the students to go to the multiple people and ask for the recommendations, because at the end everyone is talking about from their experience. So if you take advices from the multiple resources or from the multiple platforms, at the end you will find yourself confused, like which guidance I need to follow. So it's always advisable, it's all up to you, it's your decision that which platform or which guidance you want to follow. But again, I will advise you to follow a single platform. Thank you, Dr. Sophia. Okay, Dr. 00, it would be better if you rename your device. Okay, your question is, if someone completed 4-year residency of FCPS, and then how many years needed for exam from part 1 to 3? Okay, I have seen many doctors who clear 3 parts in one go. For instance, if they have booked MRCG-1 exam in January, uh, after that they in single go they book the part 2 exam in July, and once you're done with MRCG part 2 exam, uh, for the part 3 there is nothing left to study a lot, so you can easily pass the part 3 exam within the preparation type of 3 months. So it would hardly take 1.5 years. But again, this would require a lot of dedication and a lot of commitment. But yes, that's doable. I have seen many doctors who clear and get their complete membership in 1.5 years. Yes, because MRCPI have no part 1. So if you have done your MRCG part 1 exam, or if you have cleared your FCPS part 2, your MRCPI 1 would be exempted, and you can simply book your MRCPI 2. Dr. Momo, your 1-year internship experience, the question is that 1 year completely you worked in Obs Gynae department or no? Because during internship, as far as I know, either we have 3 months experience or 6 months experience. Dr. Nabia, I will suggest you to continue your clinical practice. If you have 2-year resident experience, then try to complete that 4 years. If not, if you are doing 2 years diploma or the membership exam in your home country, try to pursue your career and complete your 4 years of clinical experience, either as a consultant in your home country. Okay, Dr. Saima, your question is there any scope of MRCOG in Canada? That's a very debatable question, because in Canada, every country has their own rules and regulations. For now, Canada is not taking immigrants. They are preferring their citizens when it comes to hiring the doctors. Okay, so do we have any other questions? Dr. Seva, yes, I have already mentioned. Yes, there is question bank. For this exam, we have to cover the exam-like questions, and we have different pools. We have subject-wise pool, and we do have year-wise pool as well. And at the same time, I have already recommended some books for the SPA practice. So yes, there is a plenty of SPA pool. Yes, doctor, I can repeat the process for how you can apply for the MRCOG exam. Let me go back to that slide. Okay, so the first step in terms of your booking, you have to go on the RCG website, make your account there. And that's a very simple process. All you have to do is you put your email address, set your password, and in no time you will get registered on the RCG website. Now, the second step is you have to fill your eligibility form. We have that eligibility form. We can drop that in the WhatsApp group. You can have a read on the form. Okay, in terms of eligibility, this process takes 3 to 4 weeks, and sometimes it may take 6 weeks. And for eligibility, you have to fill the form, then attach your medical degree or your medical license along with your ID card copy or the passport photocopy or the original picture you can attach. And once you mail them, you have to wait for 4 weeks or 5 weeks on average. And then you will get an email, a confirmation email by the RCOG that your eligibility has been done. It is confirmed. So the next step would be you need to go on the RCOG website, log in into your account and submit the expression of interest. This is your initial steps. And the last step, which is your booking, how you can book your slot is happen when they announce the seats. This is so for now, just focus on creating an RCOG account. Fill your eligibility as soon as possible. Don't waste your time because there is no recommended timeline for that for now. And yes, once the portal is open, you can, once they upload the exam calendar for 2025, you can submit your expression of interest. And meanwhile, please stay in the study groups or the January group so that you will stay updated when the portal is open, what are the dates and what is the exam calendar for the year 2025. Yes, Dr. Saima, you are eligible for the Part 1 exam. Do we have any other question? No, doctor, for MRCOG Part 1 exam, there is no clinical experience is required. However, if you have clinical experience during your internship time, that would help to solve the clinical management questions. Dr. Yashmita, you're asking about the MRCPI Part 2. Yes, our team will guide you further regarding that. Doctor, for MRCOG Part 2 exam, this is relatively tough exam. And the curriculum is very extensive, and it depends on your clinical experience as well, and how much time you can dedicate to study for this exam per day. However, ideally, the doctors take 8 to 1 year to prepare for MRCOG Part 2 exam. But yes, if you have plenty of time, many doctors clear that in 6 months of time. But for Part 1 exam, the duration for exam preparation is 3 to 4 months. For Part 2 exam, it would take 6, 8, or 1 year maybe. And for Part 3 exam, 3 months are enough. Doctor, here it depends where do you want to relocate. MRCOG have its own significance and MRCAPI have its own significance. Dr. Seva, if you are having 3 to 4 months for the MRCOG Part 1 exam, then on average, you need to study at least for 5 hours per day. Dr. Seva, I'm so sorry to hear about that. However, everything happens for a reason. And again, every failure have a reason. So don't worry about that. If you haven't given up on anything, it doesn't count as failure at all. So stay motivated. Do we have any other questions? Dr. Seva, I'm so sorry to hear about that. Don't feel that way. The things which have destiny has decided for you will come your way. So maybe that exam wasn't the part of your journey. Okay, so Dr. Wajiha, for MSRA, if you want to book MSRA exam for before that, you need to have GMC registration because without GMC registration, you cannot book the exam. And MSR is a generic exam. Once you have your score, you can apply to different specialty by using same MSR exam results. Dr. Seva, don't feel bad about this. Now you have plenty of experience and you have already a lot of knowledge. And I would advise you to start your journey from scratch again. And if you are copying MRCG-1 exam, I will highly appreciate you because you already have studied for this exam. So I'm sure you have plenty of knowledge and experience, and you can easily pass this exam. No, Dr. Vijaya, that's not the case here. Uh, you can text us on the WhatsApp so we can guide you in the detail because every specialty have their own criteria. For instance, if you are applying by using your MSI score to the psychiatry, the criteria would be different. For radiology, criteria would be different. For obs and gynae, criteria would be different. Dr. Seva, MRCG-1 is highly doable exam because it's all about the basic information and the mainly questions come from the high yield topics. So the main tip for passing this exam in the first go is that you have to study smartly. You need a proper assistance and guidance. And if you know the basic tricks to pass this exam, then definitely yes. And another thing, the passing ratio for MRCG-1 exam is very good. Roughly takes percentage passing. It's a percentile system and it ranges between 67 to sometimes 72%. Last time, I guess it was 68%. Okay, so best of luck everyone for their MRCOG journey. And I wish you everyone pass the exam in first go. And meanwhile, if you have any question, any query regarding the exam or the booking or anything, you may simply contact on this contact details. Here's the WhatsApp number, Facebook link, and the email address. Welcome, Dr. Vijaya. Welcome, Dr. Saima. I hope I will see you again in the next session. Thank you so much for participation and for the active listening and appreciating our effort so far. Thank you so much.